Fat burners in bodybuilding, science, benefits, and risks. Episode 1, Clenbuterol, the Hollywood Fat Burner. Introduction. Today we're diving into one of the most famous and infamous fat burners in bodybuilding and fitness, Clenbuterol, a compound with a reputation for rapid fat loss, shredded physiques, and also serious health risks. What is it? How does it work? Why do bodybuilders use it? And what are the dangers? Let's break it down with science, history, and bodybuilding context. What is Clenbuterol? Originally developed as a bronchodilator for asthma, it belongs to the class of beta-2 adrenergic agonists, drugs that stimulate the beta-2 receptors in the body. In medical settings, it helps open airways, making breathing easier. In bodybuilding, it's used off-label for its fat-burning properties. Mechanism of action. Clenbuterol binds to beta-2 adrenergic receptors in fat and muscle cells. This increases CAMP, or cyclic adenosine monophosphate levels, which activates protein kinase A. The result: increased lipolysis, or breakdown of stored fat, thermogenesis, or heat production, higher metabolic rate, appetite suppression, which is a secondary effect. It has a long half-life, which is approximately 36 hours, meaning it stays active in the body for a long time compared to stimulants like caffeine. Why do bodybuilders use Clenbuterol? Cutting phases. Clen is often used before competitions to shed fat while trying to preserve muscle. Rapid results. Noticeable fat loss within 2 to 3 weeks. Muscle preservation. Some studies suggest a mild anti-catabolic effect, which protects muscle. Stacking. Often combined with anabolics, T3 thyroid hormone, or fat-burning peptides for extreme cutting cycles. Dosage and cycling in bodybuilding use. Warning: this is not a recommendation, just reporting common practices in bodybuilding. Men start 20 micrograms per day and increase gradually to 80 to 120 micrograms per day. Women usually 10 to 20 micrograms per day, increasing up to 60 to 80 micrograms per day. Cycling: 2 weeks on, 2 weeks off, to prevent receptor downregulation, or incremental tapering cycles. Stacking, often combined with T3 or anabolics. Warning: side effects and risks. Clenbuterol is not harmless. The list of side effects is long and potentially dangerous. Short-term: tremors, shaky hands, insomnia, sweating, anxiety, headaches, nausea, rapid heart rate, or tachycardia. Serious risks: cardiac hypertrophy, or enlargement of the heart muscle. Arrhythmias, or dangerous irregular heartbeat. Electrolyte imbalance, low potassium, taurine depletion, which lead to muscle cramps. Sudden cardiac death, which is reported in athletes and celebrities. Scientific evidence and studies. Animal studies increase fat loss but also cause heart muscle damage. Human data limited since it's not approved for human use in most countries. Case reports. Hospitalizations from heart attacks linked to Clenbuterol use. Clenbuterol in sports and media. Nicknamed the Hollywood diet drug, used by celebrities for red carpet cuts. Banned by WADA, the World Anti-Doping Agency. Multiple athletes have tested positive for Clenbuterol in doping scandals, in cycling, boxing, and track and field. Psychological side. Many users report dependency, not physical like opioids, but psychological. Fear of losing the shredded look without it. Over-reliance during cutting season. Conclusion. Clenbuterol is one of the most effective fat burners in bodybuilding history, but it's also one of the most dangerous. It works, no doubt about that. It melts fat, preserves muscle, and gives a lean, dry look. But the risks, especially to the heart, are real and well documented. Professional bodybuilders and even celebrities have used it, but also paid the price in health. As with all performance-enhancing drugs, the science is clear. The short-term gains can come at the cost of long-term health.